So next is Dr. Sriram. He is consultant at Shankara Hospital, Panvel, and going to his hometown back to Guntur.
Good morning, everyone. Thank you, Divyan sir, for the opportunity. It will not take much time. So it's a case when I was in Guntur. A 9-year-old child was brought by her father with saying that the child is having issues at the school. The child had blurred vision for last 1 year, but they came after a 1-year duration. They didn't give any past history of any other previous ophthalmic records. The vision in right eye was 6/12 parts and left eye was 6/24 with no further improvement. She was a myopic child. Anterior segment was quiet. There was no AC reaction. So the child presented to us in August 2019. This was the fundus appearance. There was no vitritis. The media was clear. There was peripapillary subretinal lesion, yellowish lesion with one margin towards the macula may be active, but clinically it appeared inactive. And we did an OCT. We can see here a subretinal fibrotic tissue-like structure in both the eyes. There was no intraretinal lesions in the right eye, but left eye had few cystic changes. We advised father to get evaluated for uveitic profile, but they just ignored. They never turned up with any of the evaluation being done. Then again, because there was further drop of vision, that father again got the child in Jan 2020. That was after 5 months. At this time, the vision in right eye has dropped to 6/36, and in the right eye here we can see mid-peripheral yellowish RPE lesions, which was not there earlier. Again, in the OCT, there was only the predominant lesion was subretinal and no macular edema or CNVM lesion. But what we can see that compared to August 2019, the lesion in the right eye was crawling or migrating towards the macula. So even now, even at this visit, the child did not come back again, did not get evaluated, no treatment, nothing. I could not start on anything because I don't know what to do. Like I did not give any steroid, I did not give any antibiotic. AC was quiet, vitreous was quiet, only migration of the lesion. So in March, child came, the vision was 6/24 in both eyes. And at this time, I convinced the father and we could do a FFA for free of cost, like just to identify. They were not even willing for any evaluation. So this is a montage image where we can see that in addition to the posterior pole lesion, in the mid-periphery, superiorly and inferiorly, we have fibrotic lesions with multiple RPE pigmentary disturbances. Similarly, in the left eye also, we can see fibrotic lesions here. And this was the FFA. There is no active leakage. There is staining of the lesions. And I could not get periphery FFA images because child was not that cooperative for imaging. So this is the timeline. The child presented to us in August. And as the few months progressed, we can see that the lesion is migrating towards to a fovea in both the eyes. And the leading edge is somewhat maybe, I don't know, the less fibrotic, that's why it appears little, maybe different shade of color than the rest of the lesion. We sent to an rheumatologist, and this time they got the child evaluated. The ESR was raised 40 mm in the first hour. Rest of the parameters were normal. Rheumatologist got an ANA levels also done, which showed a CNCA positive. And torch analysis was positive only for herpes virus. Rest of the viral profile was normal. Even HIV and rest of the tests were normal. I didn't add here. The rheumatologist called me and said, "Sir, I think we should start the child on acyclovir. It should benefit the child." Though I have not seen such case, but child was started on acyclovir. At this visit in March 2020, I felt that retrolental cells were there and I started on topical FML. That's it, no oral steroids or anything. From November 2020 to Jan 21, the child is on acyclovir and the lesion did not progress further. The lesion was stable. So I just want, this is the imaging from 2019 to 2021. Child has not been on any form of oral steroids or immunosuppressants. The only medication the child got was acyclovir for 4 months and topical FML. So I just wanted to ask, any experience with such a case, and what would they When I searched the literature, the closest I came to was a case of progressive subretinal fibrosis. There is no diagnostic criteria for such a case, no histopathological proof. They have one in a deceased patient, they had shown a histopathology later on, but I cannot confirm the diagnosis by histopathology or anything here. Like what they have reported was that it is seen in healthy young women. The youngest age they reported was 6 years. Here the child is 9 years. But in the cases, they reported that it starts as choroidal lesions, choroiditis, and later it fibrosis, and the progression tends to happen slowly over months. But here I could see that the amoeboid movement happened over 1 month, 2 months progression itself. There is no proven hypothesis why is it what it is, though few authors have tried steroids and immunosuppressants, but how long can we give the child immunosuppressants or steroids, and what to do in such a scenario?
So, Sriram, can we put the, so comments from the panelists?
For how long, sir? She is a 9-year-old child.
What is it?
Sir, once fibrosis, the literature says that once fibrosis has set in, then there is no role of.
Is it known to occur in children?
And it is progressive.
Bilateral symmetrical.
So this is usually associated with CNVMs is what one more suggestion is, and this is this one, yeah. So whether this is a blood, so because the FFA is not showing.
FFA is not showing any.
So that this is the time when he did an FFA also. So
this is the left eye, sir. This is the right.
Yeah. So this
it's not active leakage as such.
Staining
of fibrotic lesion.
Yeah. So that, yeah. But vision,
vision was stabilized at 624, sir, in the last
visit. The same. So, and OCT is not showing any edema. Heme, yeah.
Did you do an eosinophil count in this patient?
No, sir. I did a hemogram, but we did not send for a individual. Sir. The child was not at all affording. All these tests were done free of cost by the rheumatologist.
The peripheral fibrosis and the migrating lesion that you're talking about somehow rings a bell. It could be a nematode infection in the eye. Of course, bilateral is rare.
It's DUSN.
DUSN, which is DBSN actually.
DBSN, okay.
2 worms in 2 eyes.
So can we label it as progressive subretinal? Physician wants acyclovir to be continued, but I told the parents, see, I cannot help further. The rheumatologist takes a call now.
She is not able to afford FFA and antivirus.
That's what.
First antivirus.
I have to call the patient again and see now.
Now you're
Actually,
going back
I was
this,
in Maharashtra.
2022. You can follow up. Okay. So thank you all, and thank you for attending and actively participating in our IC. So thank you again the moderators and the panelists, and thank you the presenters to provide such fantastic cases. Yeah. Melanoma.
Thank you.
Diagnosis unknown.
Divyansh, that was really, it was like a mini RetNet India.
Oh, sir, sorry. Sir is not there. I should not take any advantage of that because it's his baby. We are trying to carry it forward, sir. And yeah, so we would do our best next time also, sir. Thank you. Thank you, sir.